Yeah, good afternoon. I'm going to talk about Indecaterol and Salmeterol. What is Indecaterol? Indecaterol is a medical to use respiratory systems that agent system for attractive airway disease adrenergic inhalation. Selective agonist beta-2 adrenergic receptor mechanism of action. Beta-2 adrenergic agonist long-term stimulate intracellular density which increase by the cycle AMP, relaxing air smooth muscle.
Most commonly used in the treatment of asthma. It can also be prescribed to treat bronchitis in people with chronic pulmonary obstructive disease. Advair discus is available to be inhaled in doses of 50 micrograms of salmeterol combined with 100, 250, or 500 micrograms of fluticasone. Advair discus is generally inhaled twice a day. Follow the picture instructions on the package and rinse your mouth with water after using this medication. The most commonly reported side effects of Advair discus include headaches and upper respiratory infections, but please ask your doctor for a complete list. Also, tell your doctor immediately if you experience swelling, a rash, an asthma attack that you can't treat with your short-acting medication, or any other significant changes.
Therapeutic indicator is treatment maintains bronchodilator or with COP, posology indicator inhalation at 150 micrograms one time a day, maximum 300 micrograms one time a day. Manage amount of indicator, it should be administered at the same time in each day. If you miss a dose, should be administered the following days at the usual time. Salmeterol is a respiratory system agent system for the obstructive airway disease adrenergic inhalation. Selective agonist beta-2 adrenergic receptor. Mechanism of action of salmeterol agonist selective long-time beta-2 adrenergic receptor. Inhibit the release of the mediator for lung mast cells, thereby inhibit inhalation release the mediator from lung mast cells, thereby inhibit an inhaled urgent response and attenuate airway hypertension.
In exercise-induced bronchoconstriction and asthma, the bronchioles and bronchiolar tree get constricted. The smooth muscle wrapped around the outside of the tubes contracts, which leads to constriction of the airways and difficulty in breathing. When we add salmeterol, it is highly fat-soluble and slides through the smooth muscle cell membranes and hangs around in fatty vesicles, where it diffuses out slowly, like a slow-release drug. The molecules of salmeterol that diffuse out activate beta-2 receptors and initiate a G-protein-linked cascade similar to dopamine. But instead of the final step being to activate a channel, the final step is activation of protein kinase A, which then phosphorylates or deactivates myosin light chain kinase. This causes intracellular calcium to decrease. It goes into storage in the endoplasmic reticulum, and hence the smooth muscle cells to relax. At the tissue and lung level, the addition of salmeterol through a metered dose inhaler causes bronchial and bronchiolar smooth muscle to relax, resulting in a widening or dilation of the airways, less hyperinflation of the alveoli, and easier breathing.
Therapy indication of salmeterol is treatment regular long-term respiratory reversible of chronic bronchial and asthma track. Asthma patients treated with corticoid also require B. Agonist lasting posology of salmeterol. Inhalation 50 micrograms 2 times a day. Children more than 4 years ago, 50 micrograms 2 times a day.